Okay, it's at the top of the hour. Hello, everyone, and welcome to our July 2023 Waste Management Subcommittee Practice Eco Session. My name is Francis Ochen from the African Society for Laboratory Medicine, and I'm excited to be your moderator today. Our session housekeeping guidance. This session will run for 1 hour. We'll take one presentation and get into the discussions. We will only have you participate through the chat, so kindly post your questions or comments and responses to any session questions that may come up only through the chat room. We have real-time language interpretation services, so keep to either English or French or the Portuguese channels. Do not stay on the off channel, because then you will not have the real-time services that we're providing. I'll also at this point ask our session presenter to go a little slow to allow the real-time interpretation to run quite smoothly for our colleagues that may be on the Portuguese or the French channels. Our session today focuses on waste management and chemical management. We know that in healthcare service delivery, and more so in our environmental, human health, and animal health labs, we use lots of chemicals in either their pure state or as component parts of the reagents and consumables that we use in the laboratories. Their proper handling during use and disposal is so key in keeping communities and the environment safe from undesirable exposures. Today, we will look at, in particular, chemical detection, methods of detection, including analysis, then common methods that are used for surveillance. The session will also introduce the role of Poison Center and their establishment, how they are important in detecting and responding to chemical events. And to take us through this, we have a distinguished presenter. Our presenter for today is Lydia Izon. Lydia is a public health specialist. She is actually a principal public health specialist with the Chemicals and Poisons team, Radiations, Chemicals and Environmental Hazard Directorate of the UK Health Security Agency. Colleagues, join me in welcoming our presenter.
Introduction, Francis. And hello, everyone. And thank you for the opportunity to be here with you all today. It's a really great opportunity to come and speak to you. So I'm very pleased to be able to do that. So as Francis said, I'm here to speak to you about detection for chemical hazards and public health. This is the second of 2 presentations we at UKHSA are delivering to the network. And I know that many of you looking at the participants have joined us last time on our general principles session for chemical hazards and public health, which is available to listen to again on YouTube if you missed that session. So in today's session, over the next 40 minutes or so, I'll be providing a brief overview of methods of detection, some common means of surveillance for chemical hazards of public health concern, and we'll look briefly at the role a poison center can play. There'll be opportunity to interact throughout the presentation today with a number of questions I'll be posing, which I'd very much appreciate your thoughts on. And we'd like this to be as interactive as possible, so please do contribute freely when the time comes. Also, if you have any other specific thoughts or questions relating to the topic as we go along, please do share them in the chat. And I have 2 colleagues with me here today, Mary and Sean from the Chemicals and Poisons team, and they'll be able to answer questions in the chat as we go along. And as Francis said, there'll be opportunity for discussion at the end of the presentation, all going to plan. So let's begin with an introduction to detection for chemical hazards and public health. But before we launch into any detail, I'd like us to take a step back and remind ourselves how people may become exposed to chemicals. Here you can see a representation of exposure linkages, which illustrates this. So on the left in green, we have the hazards themselves. As we covered in the last session, chemicals are all around us and they are many and varied. So hazard sources may include lots of different things, like industry, accidental release during transport maybe, or handling of consumer products, and pharmaceuticals can also be potential sources of chemical hazard. In the grey, you can see the environmental compartments which these hazards may enter, so water, air, land, and then further to the right, we see how then these hazards can enter or reach the human body via our food, drinking water consumption, and inhalation of air. So before we go any further, this is our first opportunity for interaction. I'd be very grateful if you could share in the chat whether this exposure diagram looks about right for your country. So are there any exposure linkages that particularly resonate with you and you think these are a real concern in my country? Or are there any that you think are missing from the diagram? So is there something there you think is a particular concern that's not covered? So be really grateful for some interaction in the chat and let me know your thoughts. Okay, so we've got some things coming in now. So soil, surface water, so they're obviously your environmental compartments and possibly also your exposure routes. Inhalation, air, food, somebody's put food in capitals, it must be a particular concern. Fish again, consumer goods and pharmaceuticals, herbs, groundwater, direct contact, surface water and air. So water seems to be coming up quite a lot. Water contamination from industrial waste, air pollution, drinking water. Water and food of particular concern, oil spills, occupational sources, mines. Okay, this is really good. It's really useful to see all your thoughts on this. Right, so feel free to keep adding your thoughts to the chat and we'll keep a record of everything that everybody has contributed. And in the meantime, I'll just move on. So thank you very much for interacting with that. Okay, so let's think now about how we might be able to quantify any of these elements of our exposure model. In practice, public health, environmental and health and safety authorities may become aware of the potential for, or indeed an actual chemical exposure through a number of qualitative means. So maybe they find out through a legal requirement for employers to report an accident or maybe a pollution incident. Maybe we find out through the public observing some contamination of the environment, or maybe they're reporting some ill health. So these are all qualitative methods. And this is where detection comes in. It can enable us to quantify what's going on and to undertake appropriate health-based risk assessments to estimate whether there's potential for or actual harm occurring. So let's think now about quantitative detection in two categories. So first, environmental analysis, and then second, we'll look at biological analysis. We can conduct environmental analysis to quantify a number of elements of the exposure model, so as indicated here by the blue ovals on the slide. We can use environmental analysis to quantify what has been released at the source of the industrial spill, for example, what is in the consumer product, how much of what chemicals are in the water and air, crops and soil. So environmental analysis can do all this for us. Biological analysis can also be important. We can use biological analysis to try to quantify what people and animals have been exposed to. So what has actually reached their bodies and what they have in their systems. And we'll look at these methods in a little more detail later in the presentation. It's important to appreciate that in most cases, chemicals are more complicated than biological contaminants in that we always need to understand the exact characteristics of the chemical or chemicals of concern in order to be able to undertake our risk assessment and therefore determine what actions we need to take to protect people. So knowing that a chemical is there is not enough information on its own. We need to know the physico-chemical properties of the chemical. And all physico-chemical means is we need to understand how toxic it is and how it behaves. So for example, is it more or less dense than air? Then we'll know if the substance will collect in low or confined places, or it may dissipate easily within the air. Is it a liquid with a high vapor pressure and therefore be more likely to form vapors as it spreads? We need all this information to be able to undertake our risk assessment. So just something to bear in mind when we're thinking about chemicals compared to biological contamination. And we can find this information from a number of both commercially and freely available web-based sources. And I'm going to share just a couple of these with you over the next few slides. Here you can see the European Chemical Agency's web resource, which includes both summary and detailed information. And that helpfully includes guidance for safe use. So that's a good one to have a look at. Here you can see the US PubChem resource, which includes safety and hazard information. And the UK Chemical Compendium Collection, which includes toxicology and incident management information for selected chemicals. And for a thorough guide to human health risk assessment for chemicals, including a whole host of other links to other international references and resources, I can thoroughly recommend this WHO toolkit, which you can see here on the screen. This has recently been updated and can be accessed freely on the web. So you may remember this slide from our last session together, and I'm sharing it again now as a reminder that detection can support our understanding of chemical exposure in relation to all three of the scenarios by which we as public health professionals may become aware of an actual or potential chemical exposure. So those three scenarios are, on the left, an environmental contamination. This may be visible evidence of a chemical release, or it might be that analysis we just talked about. Secondly, a health issue following a known exposure to a known chemical. So somebody has presented at a healthcare centre with exposure to a known chemical. Or thirdly, on the right there, people presenting with health effects where they don't know what the source of their illness is. And this is where detection can support epidemiological investigation. Let's move now to look at methods of detection. And we'd like to hear your reflections on analysis and detection in your country after the next few slides. But first, I just wanted to briefly look at some main means of detection for chemicals before we go into that interactive part. Firstly, what's key to understand for chemicals is that there is no one device or piece of technology or equipment that can be used to analyze for all chemicals. So unfortunately, there's not one piece of equipment you can buy to enable you to have a chemical analysis capacity. There are millions of chemical compounds, and even some of the common ones require different analysis technology. Secondly, not all analysis needs to take place in a static laboratory using very expensive and complicated technology. There are a range of lower cost options. Field screening techniques involve use of chemical test kits, organic vapor analyzers, and other portable monitoring devices, which can provide real-time data, but these don't normally provide exact measures of chemical-specific environmental contamination. So the kind of people that might use these techniques might be emergency responders, industry, maybe local and environmental authorities, and they may use these instruments in the event of an accidental release, or maybe as part of an investigation of the spread of contamination, for example. Mobile laboratories can also be used for chemical analysis, as they can narrow down the possible groups or classes of chemicals, which can then target sampling for static laboratory analysis. And that prevents the need to take a large number of samples to static laboratories, which can be expensive and difficult. Laboratory analysis will provide more precise and higher quality results, though, and it does not necessarily require a well-developed lab infrastructure in the place where the samples are taken, because they can be shipped to accredited laboratories. So it's more about knowing what you have where and how to get samples there. So biological samples will often be analysed in a static laboratory, or maybe even a semi-permanent mobile laboratory where there's a particular issue being investigated and that facility has been set up. So data from environmental sampling and monitoring helps to identify or confirm the presence of a chemical source, the media contaminated, and the community or communities exposed. Therefore, it's crucial to ensure that the samples are representative and have been analysed by a suitably accredited lab so that they can be interpreted with confidence. The types of labs that can support investigation of chemical-related outbreaks include diagnostic labs, clinical, toxicology, environmental, forensic, food safety, and research labs. In general, the analysis must be representative of the sampling site or medium and must be both accurate and precise. So these are common lab quality techniques. The lab should participate in quality control and assessment and follow standard operating procedures to ensure appropriate standardized approaches, and the results should be interpreted by a suitably qualified person and action taken on the results. In some cases, it may be appropriate to undertake biomonitoring, which can be undertaken on a variety of sample media, such as whole blood, serum, urine, and hair samples, for example. As we've already touched on, biomonitoring can be used to assess uptake of a chemical after environmental contamination or exposure by skin contact, ingestion, or inhalation. Biomonitoring aims to identify the presence and nature of toxic substances, metabolites, or biomarkers. The advantage of biomonitoring is that it can provide an indication of exposure which has already occurred and provides a potential to correlate internal dose with observed health effects. It also provides opportunity to analyse the actual cumulative internal levels from all potential routes of exposure at one time. So rather than looking at just one route of exposure, you can look at what is happening overall in the body. The complication with biomonitoring is that we're all exposed to a vast array of all those millions of chemicals all the time through our daily lives. And it's not as straightforward as, is it there or not? It's also very difficult to determine sources of exposure when we've got all these other things going on. Secondly, biomonitoring for chemicals is complicated because there are very few chemical exposures with straightforward signs and symptoms. So specially trained doctors and clinical toxicologists need to understand what collection of symptoms to look for to pinpoint specific chemical exposure. So this collection of signs and symptoms we call a toxidrome. And the table here provides some example toxidromes taken from the WHO guideline for establishing a poison centre, which you can see on the left there. And I'll mention that again a little bit more later. So the correlation of investigation to identify potential exposures through toxidrome understanding and biomonitoring analysis together can be used to provide confidence in understanding of specific circumstances. Moving now to think about routine environmental monitoring. A major component of an effective chemical incident management system is the establishment of a routine environmental monitoring program in high risk or densely populated areas. So this routine monitoring program should ideally include periodic measurement of chemical concentrations in environmental media where a risk has been identified. So that could be associated with a specific industrial site or maybe associated with vehicle emissions, for example. Some environmental monitoring can provide information on background levels of chemicals, as well as an early warning of potential increases in contamination. I have two slides now illustrating some portable environmental detection options, which can often be lower cost for environmental analysis. And I'm including this just to give you a flavour of the kind of things that can be accessed and a slightly lower cost than some static lab analysis techniques. So colorimetric technologies using glass tubes containing chemical media that react with a specific contaminant by changing colour. These can be used for both organic compounds and inorganic compounds. Ion mobility spectroscopy are extremely sensitive standalone devices, but are often coupled with mass spec, gas chromatography, or high performance liquid chromatography. And these can identify a range of unknown chemicals. So they're very useful where we don't know what's going on. But of course, that means they're the most expensive technology on the list here. Next, we have photoionization detectors, which can measure total volatile organic compounds. They're efficient and inexpensive, and they're widely used in the military industry and where confined working might be an issue. And finally, at the bottom there, both Raman and infrared work well for identification of unknown substances. Also wearable, handheld or pocket portable personal monitoring devices are used to enable workers in a wide range of environments to monitor exposure to gases and particles, and can be fitted with data loggers or alarms when safe levels are exceeded. For example, a hydrogen sulfide gas detector can be used across a variety of applications, such as site-wide safety, confined space entry, and first response safety. Users can set low and high alarms, which can alert the wearer and also surrounding colleagues to the presence of hazardous gas. These can be very cost-effective detection tools, and they're particularly useful for worker safety. So thank you for your patience through that part of today's session. I know there was a lot of information there, so I'd like now to ask you all to participate, if you would, by sharing in the chat your thoughts on what chemical analysis is undertaken in your country. So have a think about environmental and biological, and think about static laboratory and mobile analysis, and pop those thoughts in the chat. If you could also have a think about who is responsible for that chemical analysis and share that also, that would be very interesting to see. You don't need to indicate which country you're from if you prefer not to, really just interested to know how these detection and analysis activities happen in practice across the Africa region. Thank you all. We've got a couple of people saying that lab analysis is more used. Hydrogen sulfide in the environment department. Government analytical lab does chemical analysis. Water analysis, so some environmental analysis going on there. government departments? Somebody says it, none, no chemical laboratory analysis. Water. So water biochemistry seems to be quite a common scenario for chemical analysis. National Food Laboratory, but with not so much chemical analysis. Somebody's got a chemical safety officer. Lindy, I'm glad we're giving you food for thought. Yeah, universities sometimes do undertake these kind of tests where the expertise doesn't exist in government institutions. So that's a good idea. The EPA in Ghana does chemical waste analysis. EPA. So there seems to be a mixture of hospitals, environmental protection authorities. I'm not sure if anyone mentioned hospitals. Yeah, hospitals, university lab. A common stakeholder that undertakes analysis, but less so in Africa, I think, is emergency services. So you might have the fire service who have some detection capability. So if there's been a big fuel incident involving a lorry, for example, they can turn up and do some monitoring. Food chemistry, university lab. Okay, great. Keep those answers coming if you've got more to contribute. We'll collate all those and we'll take them away after. So please do carry on. And in the meantime, I will continue. Okay, so let us think now about surveillance for chemical hazards and public health. And we'll begin with a definition. I'm sure most of you are familiar with surveillance, but in simple terms, surveillance is taking information to action. So it's processing our data so that some action can be taken on the basis of that data. So data for data's sake is at the least a waste of time, is what I say. And at the most, it can be dangerous if we're collecting data and we don't know what we're going to do with it, particularly when it comes to people's health. So surveillance in this context can be used to detect outbreaks or provide early warning to emerging problems. It can be used to guide immediate public health actions. So for example, maybe there's a new drug of abuse, food safety, maybe there's some kind of covert chemical incident, or maybe there's a radiation release. Large-scale air pollution incidents can be detected this way too. It can be used to provide health information that can be used to guide planning and implementation of intervention programs. It can be used to monitor changes or trends in health factors, such as prevalence or incidence of disease and or risk factors. Maybe it can identify emerging diseases or geographical issues, or even particular risk groups. So groups of the population that are particularly facing some kind of challenge. For the purposes of this presentation, I was asked to present surveillance visually as a process. So that's what I've tried to do here. And I'm sharing with you how surveillance may be used in the cycle of the management of chemicals. So we call this cycle the incident management cycle, and it includes the 5 key stages here. You can see prevention, preparedness, detection and alert, response and recovery. So both detection and surveillance activities should fall between preparedness and response activities. So detection can be used as a mitigation of risk, where prevention and preparedness activities have not been sufficient to remove all risk, which of course in reality is often the case. But this is only if action is then taken on the detection data. So the timelines of analysis, detection and surveillance, and then surveillance and response, need to be scenario specific, and they need to be based on a specific risk assessment and a specific level of risk. So those timelines might be really short if you're looking at a very acute health risk, and they might be longer if you're looking at a long-term public health program, for example. So they need to be based on risk assessment. Okay, let's take a step back briefly and think a bit more about why we should bother to do surveillance. I think we'd likely all agree that surveillance is useful and necessary to reduce risk and protect our people. But helpfully, under the international health regulations, surveillance systems are required. So they're required for detection, verification, notification, and risk assessment of chemical events of potential international health concern as part of multi-hazard surveillance strategy. The Sustainable Development Goals are also useful. These were set a goal that by 2030, the need to substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution. The WHO Chemical Roadmap for Health Sector Engagement in Strategic Chemicals Management includes a number of actions advocating for strengthening the chemical and environmental and health interaction, of which surveillance is a key element. So, for example, it states that both WHO and all member states should work towards integrating health and environmental monitoring and surveillance systems for chemicals throughout their life cycle at the national, regional, and international level. And it further states that member states should make health-related chemical data and surveillance available for the local and international community where possible for learning and information sharing purposes. So you can see these international tools provide us with leverage to establish and maintain chemical and environmental public health surveillance systems at a national level. You'll all be familiar with the African Integrated Disease Surveillance and Response Mechanism, which moves to integrate surveillance. I've been reliably informed that whilst requiring some further development, there is surveillance capacity for chemical hazards in Ghana, Kenya, Lesotho, Namibia, and Tanzania. And I know from first-hand experience of our UK International Health Regulations project that Ethiopia, Zambia, and Nigeria are also working on chemical surveillance. However, in its 2017 report on chemicals of concern in Africa, which we introduced in the last session, only 32% of African countries self-reported as having such capability or alerting systems. So there's still clearly a lot of work to do across the region in terms of chemical surveillance. I've been asked to briefly mention worker surveillance for chemicals as a specific subgroup of people, and I know that this is an area of interest for many people in the audience today. So in the UK, we have a specific governmental agency called the Health and Safety Executive, and that agency is responsible for worker safety. So that responsibility falls outside of ourselves as the public health agency. And we refer to worker safety as health and safety in the UK. So health and safety law in the UK places responsibility on all employers to take action to protect the health of their workers in line with both legal requirements and codes of practice, which are quasi-legal instruments. So employees also have responsibility to behave in a way which minimizes risk to themselves and others. So it places responsibility on everybody, essentially. I've included here a screenshot of a law we have, which is called COSH, Control of Substances Hazardous to Health, and that requires employers to control substances which may be hazardous to health to reduce worker exposure. I know many of you will have some similar mechanisms in place. You can see here I've included the HSE's definition of health surveillance for your interest, and I've also included a link to the UK HSE website, where you can find further information on COSH and health surveillance for workers if you want to see an example of how we manage that in the UK. You may also want to have a look at the International Labour Organization website that may contain some similar information on health surveillance for workers. So let's move back now to thinking about integrated surveillance. So if there's any public health colleagues on the call, you'll be familiar with the surveillance techniques listed on this slide, possibly through infectious disease surveillance. So all of these techniques can be applied to chemical surveillance, and therefore there's no reason that chemical surveillance cannot be integrated into existing systems. So there's no need to set up new systems just to make sure that chemicals can be included. So I'll briefly run through a few of these just to give you an idea about what they mean. So event-based surveillance is the rapid capture of information on potential public health risk that may have significant impact or be the result of an incident or event. So basically, you're collecting information on events that have happened. And events can be quite broad in definition. So they could be an alert from an emergency service. They could be an official reporting system. So every time you have a complaint about a chemical exposure, you record it on a reporting system. It can also be active screening. So for example, trawling through media reports, looking at internet sources or collecting rumor information. This information can then be used to identify trends and patterns of symptoms, and that can indicate that something might be going on in the population. So briefly, indicator-based surveillance is a collection of information on predefined indicators, which may be specific diseases or chemical concentrations in the environment. So environmental monitoring can be an important data source here. It also is a useful surveillance method where environmental biomonitoring screening is taking place for a range of chemicals. So a common indicator-based surveillance is lead poisoning in children. It's quite common to have that as a chemical surveillance project, where blood lead level analysis is carried out possibly in a particular population of concern, in a particular age group, or maybe as part of a general biomonitoring program. Syndromic surveillance is the identification of clusters of illnesses or syndromes. So for example, for chemicals, we might be looking at respiratory, cardiovascular, strokes, and those kind of things that can indicate that events might be occurring. They can be particularly good for rapid surveillance and response and public messaging, and they can be useful for longer term issues. In the UK, we use syndromic surveillance for air pollution, and we use that to provide messages to the public when air pollution levels are particularly high, and we link that to things like asthma and cardiovascular issues. So now, again, it's your opportunity to interact, and we'd like very much to hear from you about what chemical surveillance you think might be happening in your country and who you think might be responsible for that surveillance. And just bear in mind that surveillance is the conversion of pure data into information that we can then take action upon. So please share your thoughts in the chat. Okay, so a couple of thoughts coming in now. Somebody said there's no chemical surveillance in their country. Survey of chemical waste from factories. Event-based system. So Dr. Mohammed, just looking at your comment about there being no chemical surveillance, I'm just wondering if there's any maybe environmental monitoring that maybe an environmental authority undertakes, and then they do something with that data. So for chemicals, that's often the first step in surveillance. The environmental side is the one that might pick up things, and the action might be a public health action, but maybe the surveillance itself is managed by the environmental authority. Event-based surveillance seems to be a popular one. No chemical surveillance. Chemical waste. Environment authorities coming up a couple of times. Benzene levels. So somebody's saying that I think it comes up in general surveillance, maybe. It's included in general surveillance. There's an Environmental Protection Authority, but no chemical surveillance. Okay, NEMA carry out periodic surveillance in Kenya. I think that's Environmental Management Authority. Okay, so a lot of people are saying there's maybe not that much surveillance going on. So I guess that represents maybe that statistic that I shared that WHO published around a third of, 2/3 of countries in Africa not having integrated surveillance for chemicals in place. So yeah, maybe factory surveillance for occupational health is more common, environmental surveillance. Somebody's mentioned food and agriculture and animals. That's a good one not to forget. Sometimes that does get forgotten, and I guess One Health is a whole different topic, but it's important to remember animals and food sector. Somebody just said that same thing. One Health and chemical surveillance. Yeah, really important to link the environment, public health, and also animal health. Many agencies exist in most countries, but they're not functional. So thank you ever so much for engaging with that. If you've got any more thoughts, please do share them. We'll collate them all together after. And I'll continue for now in the interest of time. So appreciate we're all running a bit close to running out of time. Okay. So we'll move on now to the final topic of the session today, and then hopefully we'll have 5 minutes or so for questions, and any unanswered questions at the end we will take away and get back to you. So please do think of them and save them up. So our final topic is poison centres. So the WHO, in its guidelines on establishing a poison centre, defines a poison centre as a specialised unit that advises on and assists in the prevention, diagnosis and the management of poisoning. Its primary role is clinical, so advising on and in some cases providing treatment for poisoning cases. The structure and function of poison centres varies around the world, so there's no one model that's advocated for. It depends upon the needs and circumstances and resources of each country. But as a minimum, it's recommended that a poison centre is an information service. So poison centres may also include a clinical treatment unit and/or a lab that can provide toxicology analysis. The data collected by poison centres can be used for public health purposes and to support the sound management of chemicals. So other potential roles of a poison centre include organising antidote supply, involvement in research, education and training, and advising on environmental exposures to chemical substances. Poisoning surveillance can be undertaken using data on poisonings to identify potential public health issues. For example, it can be used to identify if maybe there's a contaminated product new on the market. The design of such surveillance needs to be country specific, depending on the need, as I've already said, but the WHO guidelines have some excellent information to guide the process of establishing a poison centre and using it in the ways I've just described. And we have been working as UKHSA with a number of countries in the region to roadmap the establishment of poisons services. Here you can see some common models of poison centres. So ideally, as I've said, there are a number of things it can do. And a robust system would have all three of the things on the screen here. So a toxicology lab, ideally sited where samples will be collected, a clinical treatment ward, where specially trained medical staff can treat poison patients. And in the middle there, the information and advice line service. So if the other two can't be available, then the advice line is where to start. And they can be very invaluable, both in terms of clinical treatment and public health surveillance, even if you don't have the lab and you don't have the treatment unit. The photo in the middle and on the right there are ones that we took in Ethiopia during the course of our ongoing project to help them set up a poison centre. So let's look now at some international context. So according to the WHO, less than 1/4 of all of Africa has access to a poison centre, which presents a challenge, both in terms of understanding of risk, but also in terms of reducing and controlling that risk. It's also a problem because we need to be able to demonstrate poisons information access for compliance with the international health regulations. So the IHR requires an operational poison centre to be able to demonstrate capacity for chemical events and public health. So in terms of what's happening with poisoning around the world, for unintentional poisoning, there's an estimated 106,000 people dying worldwide in 2016, with the majority in lower and middle income countries. That equates to a loss of over 6.3 million years of healthy life, so DALYs. For intentional poisoning, nearly 1 million people die each year, with pesticide ingestion causing 20% of suicide deaths each year. And maybe that's something that's familiar with you from your context in Africa. And snake bite is a very real risk for many African countries, but it's largely unrecognised public health problem, with over 5 million snake bites occurring each year. In its guideline, the WHO also recommends some priority tests which a toxicology lab could focus on developing, and then it categorises these tests that need to be undertaken urgently. So those on the left are those that need to be undertaken urgently in the event of a possible poisoning. And the ones on the right are the ones that need to be taken less urgently. So these are things like lead and mercury. So further description of this and other aspects of poison centre design can be read in the WHO guideline. So I recommend having a look at that if this is a topic of interest. Okay, so as you've heard, there's very little data on the state of both poisoning and implementation of poison centre in Africa, but they are undeniably valuable resources for us to be able to understand what's going on and ultimately what we can do about it. The WHO African Poison Centre Network, with members from across Africa, and some of them may be on this call, met last week in Zambia to pick up the discussions on strengthening this underserved area of both healthcare and public health. We would now really appreciate your reflections on whether you have access to a poison centre in your country or clinical toxicology advice, if not, and how and which populations use this. So, for example, if it's targeted at the public or workers or everybody, if you do have one. This is the last question. So after this, we'll have time for some questions. But if you could just share your thoughts in the chat, that would be really appreciated. We've got some answers coming in. Okay, yes, but only available to high-profile individuals, I think it says. Scrolling up fast. Not aware of poison centre in Nigeria. I can tell you Nigeria are looking into setting up a poison centre. At the moment, we have a project with them. Public and private have access to poison centre. Not sure. Some people not sure. Some people confident that there isn't? Not in Uganda. Okay, so there's one for health worker access, somebody says here. So there's a model where health workers can access poisons information. Case comment about Nigeria here. Poison centers and clinical toxicology centers, mostly in tertiary healthcare facilities. For Angola, yes. It's really good to hear that there are some poison centers across the region. Okay, that's really useful. Thank you for sharing all your thoughts on that. Please feel free to carry on sharing. We have not so much time left. So do you want me to hand back over to you, Francis, for questions?
Thank you very much, Lydia. A very comprehensive and, would I say, awakening session. We've dealt with so much, the methods, equipments that are required for detection, multiple that you may need to use for either the very many chemicals that you're targeting or even one. You may not necessarily be the static lab that does the detection, but I think it is our responsibility to really get to know where the services are and be able to refer for those that we cannot do as a static lab. We should know where those capabilities are. And I like the fact that you brought in the issue of integrating surveillance for chemicals. And so the approaches are the same. It is just the agent that is changing. And so integrating this wouldn't be really as difficult for the countries. We may not necessarily be having a lot of countries doing active surveillance for now, but as people are dealing with a lot of chemicals, and I'm referring to the lab practitioners and healthcare providers, we should be collecting data, accurate and quality data on an ongoing basis that then can feed into the surveillance function of the work that we are supposed to do. We are quite low on time, but we have some quick comments. Allow me also to thank the two colleagues who've been dealing with some of the questions and comments that are in the chat. But we'll all the same take a few. And I think the first, and this will be really quite brief on your side, how does one monitor or detect toxicity when you're dealing with multiple agents together? Call it mixtures. So you have chemical agents that are like in a cocktail, because we deal with wastes that have multiple chemicals therein, or we are in a space where we're storing multiple chemicals. How do you deal with the detection of mixtures? That's the first question.
So we'd start with a process really of going back to your desk and trying to understand what might actually be there based on your qualitative knowledge. So what's been there historically and those kind of things. And these kind of things can give you clues to where you should target your detection. And then you target your detection appropriately. This information is not always available, and you may just need to do a suite of analysis. You may just need to do all your metals and all your hydrocarbons and everything just to be able to pick up what's there. And that's when you do potentially need to use more complicated analysis techniques. But if you have a good idea, for example, what industry was there, and you know that industry produces something that you can pinpoint that detection. For example, it could be a mining area and you can identify some heavy metals, then you can target your analysis to that. But where you have no idea, then you would be looking at doing suites of analysis, which then you're looking at your more complicated analysis. And I think that is a particular challenge for chemicals, because it is more challenging to do these suites of analysis. You generally need more complicated equipment, reagents, or your supplies that need to support that piece of equipment, maintenance and those kind of things. So I would definitely say there's a lot of value in doing your homework first, trying to understand what could be there, what you could be dealing with. I'll keep it short. That was my short answer.
Thank you very much. I have one other question that is coming in. It relates to neutralizing chemical waste prior to their disposal. And what is your comment on that? Neutralizing chemical waste before their disposal, but also monitoring the final disposal area for that waste that is seemingly neutralized.
Yeah, this is a complicated, very big topic. And you do need to understand what you have before you can target your remediation technique to that appropriate chemical, because some techniques are effective for some chemicals and they're not for others. And you also need to think about things like sustainability. We can't just put everything in an incinerator. There might be a more appropriate technique. So you need to understand what you've got, what concentrations you've got, and ultimately what you want to do with either the site that you're taking that waste to or the piece of land where you're cleaning up. So basically it comes back down to your risk assessment, understanding what you've got there and understanding what you're trying to achieve with cleaning it up. So there's a combination of technical risk assessment, but also understanding the wider context about what people might still be there and those kind of things. If it's useful, we can send a link to some guidance from the UK on things like land cleanup and waste remediation, if that's useful.
Okay, thank you. Thank you very much, Lydia. And we'll just take one more in the interest of time. We're quite limited on time. But just to add a comment on the neutralization bit, I know that we deal with a lot of chemical waste. Others are in liquid form and others are in other forms. And so it's also important that we monitor the effect of that neutralization. Is it actually effective? And you may not necessarily have in-house capacity to do the ascertainment of that effective neutralization, so to speak. And like Lydia indicated, you can get a referral mechanism so that then you can ascertain really the effect of your neutralization. How much of that are you achieving before the final disposal? The last question is a general one, and it's coming in from Simon Ojore. And Simon is asking, at what point do you introduce the concept of One Health in chemical surveillance, since you spoke about integration of surveillance? And you can deal with that question and also make your final remark related to this session as we get to winding it up.
Okay, thank you, Francis. Yeah, I did spot that comment in the chat. It's a really good point, and it's one that we're strong advocates for One Health. And it's, for those that don't know, it's the interaction between the environment, the natural environment, the human environment, and animals. So that's chemicals and infectious diseases. And there is very little published information on the interaction in chemicals part in that. So if anyone's got a particular interest in that, would be interested to hear from them. But yeah, it's really important to remember that these things are connected together. I didn't mention it as a concept just in the interest of time, but yeah, just be reassured that it's something that we're strong advocates for and interested to have any conversations with anybody who would like to about that.
Thank you. Thank you very much, Lydia and team. Colleagues, we've come to the end of this session. Thank you for all the interactions we've had through the chat. It was very, very encouraging and letting us know how much is happening on the continent and beyond. We will share all the session materials on our usual platforms that you're aware of. And this should come in by the end of today on some platforms and in a day or two on the other platforms that are available. Thank you for being with us until we meet in the next session, which comes actually next Thursday. Have the best of your day, evening, and night, wherever you're joining us from.
Thank you, Francis. Goodbye, everybody.
Thank you, Lydia.